to everyone. And today we are going to talk about this global awareness trends in HP education. And myself and Dr. Zeba, we will be conducting this particular session. Uh, so, uh, so what are our learning outcomes for today's session? The first is that we should be able to describe need for having awareness regarding trends in HP education. Why should we know about it? Uh, we shall be able to present brief overview of factors that can impact HP education, giving few examples, and then narrate major changes which can take place, and they may be at social, technological, economic, ecological, political, value related, occurring since the start of the current millennium. We will take in the last 4 years that initiated the changes in HP education. And uh, we should also be able to state the emergent, whatever the trends which have been emerged based on these changes, and reason out whether they are been able to meet these changes or still we have to wait. And lastly, suppose we want to take up such studies, then the use of this STEEP model, we will see how to use this to predict the changes which are occurring in future. So with these learning outcomes, let's start with today's session. Dr. Zeba.
Yes, ma'am. Thank you, ma'am. Good evening, good afternoon, and good morning to all the participants from all over the world. So, thank you, ma'am, for introducing this topic and the learning outcomes for today. Now, before we begin to actually discuss about the changing perspectives and the trends and the challenges before the HP health professionals in the field of medical education, we should have a brief overview of the historical perspectives, how and why this need was felt. So, in 1984, an Association of American Medical Colleges, they published a report entitled "Physicians for the 21st Century." This quotation from the same paper that they provided many insights into the medical education reforms, such as the value of integration. At that time, also they understood that integration should be there, increasing the use of active learning process and methods, self-directed learning, improving communication skills, and increasing problem-solving activities. So what we are discussing today, it was thought about a long back. Next slide, please. Subsequently, in 1993, a report released by the Academic Medicine, The Road to Implementation, titled Educating Medical Students, Assessing Change in Medical Education, The Road to Implementation. This report identified educational problems by surveying the medical school deans, and they suggested ways to deal with these issues and presented an action plan. In 1998, the World Federation for Medical Education, again, they announced that the goal of medical education is the production of a physician who improves people's health. So it's not that we are just educating and not just taking the exams and passing the students. Our main goal should be production of the health professionals, the physicians, the nurses, the staff, all the people who are involved in the healthcare, who ultimately benefit people's health. So it has been throughout the past many years, throughout history, the medical education system has tried to find better ways to educate their people, students. What has happened since last few 24 years, like since 2000, the changes in the political and economic conditions, epidemiology, social developments, and the advancement of science and technology have necessitated the health and medical education systems to change. So the only permanent thing in life is change. We say this thing that we have to be dynamic, and so it applies to the medical education also. And what are the 21st century skills we need our students to learn? Of course, we require them to acquire the facts from the theory, from the books, memorize them, store them for future use, for use at subsequent stages, but they should not stop here. It should be transformed into a process of learning where they can perform the task by themselves with confidence and taking the whole society as a part of the healthcare system, like they should not be performing individually. So that is how this 21st century has given more added more facts or added more responsibilities upon the medical education system. So what are these requirements in the 21st century which we are facing is that we should help our students to acquire appropriate competencies, transferring the knowledge to the world beyond the classroom. It's not just in the classroom, they should know what we are teaching. It should be applicable to the world outside the classroom. Also, this knowledge should not stay in it should not be focused in the domain in which they are working. It should be integrated and spread to the other contexts also. Like it's not that a person who is working or who has studied in a engineering institute, he cannot work in a health setup, because both are being integrated now. So we are transferring the knowledge for the benefit of both to newer vistas and newer contexts. And every day in these processes, we are facing new challenges, and we should have the adequate competencies to tackle them. These are the basic requirements for 21st centuries. Now, coming to the competencies. Now, I hope that all of you must be aware of the three domains of three types of competencies which our students should know, pertaining to knowledge, the skills, and the abstract part or the affective domain, which we say. But here, what we are discussing is that as a medical educator, what qualities we want our students to attain, which can be on the basis of cognition, it can be intrapersonal or interpersonal. So let us see one by one what competencies we want our students to acquire in this 21st century. They can be about the critical thinking, problem solving. They should acquire this quality of problem solving. Analysis. It's not that if the one thing goes wrong, then they keep on thinking about that. They have to analyze the situation, what went wrong. They should have proper reasoning. Then they should obviously have knowledge, including skills, and they should have an inquisition or a curiosity, which leads to creativity and innovation. Because innovation has to keep on. We have to develop newer things, like, for example, newer ways to diagnose diseases, newer drugs, medicines, because obviously the innovation leads science. Now, about the intrapersonal competencies which we want our students to acquire include self-esteem building. They have to be confident, otherwise they will not be able to perform in isolation or without supervision. And they need to understand the basic where they're lagging behind, and then they need to improvise upon that. They should have a positive attitude. If they're failing once or twice or thrice, they should not feel bad about it. They should keep on learning, strive for learning, and make themselves literate as well as their peers and the people who surround them. And they should be leaders in the way that they should take initiatives. As far as interpersonal competencies or interpersonal relations, if we can say, or behaviors is concerned, what we expect our students to do is that they should have a good communication skills. They should be able to work in collaboration with their team partners, and they should show a responsible behavior. Teamwork should be, the importance of teamwork should be understood. Obviously, the team will be there, but still they should have the qualities of a good leader also. And when required, they should be able to make a wise decision. And this communication also helps in trust building, whether it's among the peers or among the team members or with the patient. So they should know the quality, how to build a trust. And if any conflict arises, they should know how to amicably solve this conflict. So these are the qualities, basic qualities we want our student to develop in these times. Now we all know that this health education or this medical profession is not a one-time learning that you learn once and then you keep on working. It's a lifelong learning. Obviously, we are also learning, and you people are also taking some points from our these presentations. So it's a process of lifelong learning. So initially, like if we see the journey of a small child, they go to school, then university, then they enter the work life. So when they're in school, they're just learning the basics. And then in the university stage, they are keeping pace with the change in technology and the change in society, change in academics. And then they have to focus on their career. So all of this development, they enables us to become what we want to be in life, to achieve our goals. But we should not lose the curiosity to know more, to learn more. So we should be, and we should also inculcate this value in our students, that they should strive to be lifelong learners, and this also helps in professional growth. The more degrees or the more courses you do, the more learning, book reading, whatever good in the field, in your field of health, you're doing, that helps in professional growth also. And if we are collaborating with others also, this comes in the form of therapeutic relationship, because one is benefiting the other. Now, what are the factors? We have been working since long, like more than some people have been working more than 20 years. So now, what are the factors recently which have forced the people that we need to change our teaching methods, learning methods? What are those factors that impact the health professionals basically? So a revolution has taken place in the healthcare. It would not be wrong to say, as a result of changes in medical science and society as a whole. Now, some of these changes are changes in demographics and disease patterns. The most important example of these disease patterns you must have witnessed 2 years back, the pandemic, how it affected the lives of so many people worldwide. So these disease patterns, apart from that, also so many small these diseases which are rare diseases, they are now emerging. So disease patterns are changing, demographics is changing. Apart from that, new technologies are being used in health systems, like the use of artificial intelligence, machine learning, and they are giving diagnostic and algorithms to manage the patients. And also, I should not miss to say this, that most of the institutions are now taking help of electronic health records, and they are now going paperless. So we are using technologies, and it has come recently. There have been changes in healthcare deliveries. Like previously, we had to go to a chemist. Now we can order by our phone. So they're at our tips, whether it's doing investigations, getting medicines. Also, the corporate hospitals, they have been set up for the increasing demands of such healthcare institutions. And the health insurance, obviously, different types of health insurance. So this is a part of increased consumerism. Health tourism is also part of increased consumerism. Also, the patients have become more empowered with the advent of the internet and this Google and all, and they are showing independence. They show autonomy, that they want this treatment, they don't want this kind of treatment. So they are also showing they are asserting their importance. So they're focusing for effectiveness, efficiency, and now the course which was more tilted heavily in our favor, in favor of health professionals, is now just being balanced. Like the patient has more rights now as compared to the health professional in deciding his own treatment. So these are all factors which are impacting the health professionals as well as the institutions. Now you can see so many students are there, and just one teacher is teaching. So obviously there's shortage of teachers, as we know, especially in our setup, like in India and this region and many other countries also. So there's shortage of teachers. So what do we do? In addition to these changes, there's a growing emphasis on addressing social determinants of health in medical education. It's not that the patient will come to us and we will decide the treatment. Now we have to see the society as a whole, what factors are leading to the development of particular diseases. So we have to see, like for vector-borne diseases, we have to see what are the factors which can control the vectors, apart from giving treatment and vaccines for malaria and dengue and all. So we have to see social determinants of health, and we have to take the health of society as a whole and treat the society, not only the individual patients. So this includes, we have to teach our students about the impact of social and economic factors on health outcomes, and providing them with the skills that they can work with communities to address these issues. If they won't know what are the issues faced by their own communities, they are not going to learn the methods to alleviate them. So let us now revise or go through what are the challenges which the healthcare system is currently facing. So despite the changes which we mentioned, which I told just discussed just now, medical education has largely failed to keep pace with the challenges facing the healthcare system. Some of the challenges include high cost associated with healthcare, concerns of health equity, racial disparities, and shortage of skilled healthcare workers, providers. So this is the situation in many regions of the world globally, that so many the health professionals or the good clinicians or the surgeons, they don't want to go to the rural areas, and they want to serve in the urban areas where they can get all the facilities for a good life. So there's a shortage in the rural areas. Some of the people, they stay away from this modern medicine. They want to try only the alternative medicines. So there are racial disparities also. Some people are so poor and they don't have any insurance, so they are not getting proper treatment. So these are the challenges. Obviously they were before also, but now they have come to light because of the social media and the improved communication globally. So the current educational strategy fails to deliver value-based care, primarily because of we have been forced to do the ways to do the things in a traditional way. It was very difficult for us to start teaching with this PowerPoint presentation initially, who were used to teaching with a chalk on the board. So it takes times. It takes time for changing from traditional to modern things, and from changing to didactic lectures to small group learnings and the simulations. So it is just a phase of where change is occurring gradually, and we are all part of that change. Currently, we are fragmented. We are torn between the old methods and the newer methods. So the old curricula and the newer curriculum. So we are just in a phase of transition, and this will gradually we will recover for a better outcome, and our students will obviously benefit once we understand completely how to tackle these challenges. So if broadly, if we see till now, what are our students like? They are most of them are like, when they go into the medical field, it is told that you have to mostly do rote learning. So be a bookworm and you will pass the exam. That was the concept till now. But now with the change in the all curriculum, new curriculum, this is not going to happen. Now now our students should know that it's not that only if you succeed individually, you are going to give full justice to your being a health professional. You're leading a sheltered life, that you have a fixed, like in pandemic also, only the people who were involved in healthcare were getting proper wages. Other people were mostly jobless. So it's a sheltered cocoon life. But we have to get out of that cocoon, out of that shell. Some of them students are, because of difficulties, differences in language, the culture, and the socioeconomic backgrounds also, they are limited in one place. The person who's practicing in North India will have difficulty if he or she goes to pursue a course in southern parts of our country. So the differences in language, the culture, and socioeconomic backgrounds forces our students to stay in a sheltered environment and just keep on learning from the bookish knowledge, and apply that while passing the exam. This has been most of our students till now. Now, shifting a bit, why should we know about the trend? So the actual lecture or this today's topic was about the trends in the health professional education. Why should we know about the trends in the health professional education? Because we have seen what happened in the COVID-19 pandemic. Initially, no one knew how to continue about this education, the courses the students have been enrolled. And then came the idea of online classes. But what happened after online classes, although it was also not one-to-one, and most of the students developed, they could not understand, but they were just logged in. And some of the students, majority of the students, also experienced a computer vision syndrome during the COVID-19 pandemic. They were not able to grasp the things which were being told to them. But this pandemic, what the good thing it has done is that it has presented unique set of challenges to the health professional education, that you can take help of the technology to teach our students. And these challenges should serve as catalyst for imagining how we can deliver health professional education and training in the future. What we are doing now, like we are doing a Zoom meeting, and so many of you have joined and probably will gain from these presentations. So we should take help of the technology and to train our students and to train ourselves also, the health professionals. Thus, we need to focus. First, we have to train the trainers, and then the trained trainers will teach their students in a much better way. So for ensuring that healthcare professionals have the knowledge, skills, and attitudes necessary to provide safe and effective care to the patients, first we should upgrade ourselves, and then we are better equipped healthcare professionals who can make correct diagnosis. If we are in that field, we can administer appropriate treatments or develop new drugs or develop vaccines or perform tasks, whatever we are entitled with. Also, we can communicate effectively with the patients, the relatives, and other members of the healthcare teams. So when we are equipped with these qualities, then obviously we can hand down these qualities to our students. So we can keep up with breakthroughs in medical knowledge and development of novel treatments, because this is particularly crucial because the rapid rate of change is there in the healthcare system. Today a new drug is developed. Today this food supplement is found helpful in cancer treatment. Today this nutraceutical has come. So obviously we have to keep abreast with all these developments. If we are not abreast, what are we going to teach our students? We are not going to teach them what was developed 20 or what was discovered 20 years back. So we have to keep on changing, recycling or revising ourselves. Then only we can help our students to be better prepared for tomorrow. So the performance of clinical staff, we all know that if we want a better outcome for any patient, we need a good team. So if the performance of clinical staff is good, obviously it's because they have been trained in a better manner or they have underwent a good quality of medical education. And this is not wrong to say that quality of medical services depends upon medical education. I remember that many years, not many years back, around 15 years or 20 years back, all the countries in the this Gulf area, they asked for they were always in need for nurses from southern part of India. So why they preferred that they want people from that part, because they thought that the quality of services maybe it is better there for the nurses. So obviously the quality depends on the training, the part of training. So better we train our students tomorrow they'll be better health providers. So the principal role of patients here is the ultimate recipients of medical skills. Whatever skills we are teaching our students, it will benefit ultimately our patients and society.
Thank
So
you,
I hand over mic to Nirmala ma'am. Thank you.
Thank you, Zeba. So what Zeba has covered so far is she told you what are the different changes have happened. And these changes are pertaining to our students, pertaining to patients, pertaining to the new knowledge which is coming up because of some research, like she mentioned about the drugs. The healthcare system is changing. So all these trends are interrelated. So if we want to see the global trends, what are there? All these global trends, as you see over here, they are the trends related to the medical education system, within which are the trends related to the medical education institutes, the trends related to the medical curricula which are run in these institutions, and of course, the trends related to the teaching and learning. And these are again influenced by the trends which are related to the healthcare system. So how our healthcare system is. And this healthcare system is in turn, it's based on the trends which are related to the patients and their health behavior, as well as the diseases and health problems. So the changing scenario in each of them, which are there, that has been discussed by Dr. Zeba. Now, with this, we will go for an activity. So again, I will request Dr. Mubashir to break you into 4 groups in the 4 breakout rooms. And each of this group, you have to discuss about the emerged trend in HP education. Because what Zeba has said, is the changes or the challenges which are existing. She has not mentioned about the education system. So we have to think about what are the different trends in the education system that have been emerged because of these changes. And then you have to present before the large group. Now to that whatever the emerged trends and the reason out whether because this trend has been seen, whether it is meeting with the challenge or the changes. Now, to avoid the overlap, and there will be bound to be some, but we have divided the individual group to discuss about few things only. So group A will discuss about the emerged trends in the HP education system and the institution. Group B will talk about the curriculum models and the content, because curriculum will also have objectives. It will also have teaching, learning, assessment. All of you know about it, program evaluation. Restrict yourself to the models, maybe about the aims and objective and content. Group C will discuss about what are the trends emerged in teaching, learning, and assessment. And Group D will discuss about whatever the trends emerge as related to the student education, related to the patients, diseases, and the technology. So let's have these four groups. You can take a use your mobile to take a picture of this, and I will keep this on this particular slide. Now, all of you know our rules. We have been doing this breakout room since long time. So one of you will be the leader who will initiate the discussion. One person will be a timekeeper who will keep the time, and the time given in the breakout room is 20 minutes. So think, record it or report it, and there will be one reporter who will be reporting at the end to the entire group. Got it? So you will have to tell about the emerging trend and reason out whether it is been, if you have an evidence, you can quote that also. If don't, but you feel that, okay, this is why the current challenges or changes have been met with, you can discuss that. And then there will be presentation, and each group will present for a period of 6 minutes. And we will then discuss it out all further. Okay. So should I ask Dr. Mubashir, have you all of you understood what is to be done in the each breakout room? A. Who will be presenting from group A? Hello?
Ma'am, Dr. Nadi Hassan will present.
Okay. Okay.
Hello, but I think I'm going to be talking about the emerging trend in medical education.
System and the institutions. Okay. Yeah. Go ahead.
In our group, we discussed multiple items, but we finally come up with these ideas. We think that among the important trends in medical education is the social accountability, which have moved a long way from what was previously known as community-oriented education, and to what is known as the social determinants of health, to what is now elaborated as social accountability. It means items like equality, equity, the level of educations of a community, and all that we have to, whenever we are designing any medical education or medical school, we have to take about, we have to be accountable for the community in which that school is going to be implemented. We also talk about the e-learning and the new technology, AI, and the role of AI in medical education. It should be
covered in other groups, because that is pertaining to teaching.
The group 4 will be covering that, but you feel that education system should have e-learning and AI, isn't it?
Yeah, because we have to take an advantage of it as a trend. We have to make use of it, not to ignore it, and make the best of it.
Okay.
We also talked about bedside teaching at the era of COVID and beyond. So bedside teaching have to move from the ordinary one to a new era, the e-learning. Now we are learning in an online platform. So things are moving very fast. We
So
shouldn't
you mean to
ignore.
you mean to say that bedside learning to e-learning means that there should be bedside learning, but it should be on the e-learning platform, so
But I
anyone
mean,
can access
it is
that?
another dimension, because previously we never thought that bedside teaching can be replaced by simulator or high fidelity simulator. Now actually it's a fact that we have to appreciate it, and we have to think about the cultural aspect about it, because in developed countries, patient confidentiality, patient right, patient privacy, infectious control will render ordinary bedside teaching a problem. So high fidelity simulators will play a greater role, especially
That I think will be covered also by the teaching learning activity. That's why I said there could be overlap. Okay. What else?
yes. Also, we talked about the eye patient in the same way. And we talked about the research, especially qualitative research, as is a new era in the doctor's medical education, because previously we used to have.
Why you want that qualitative research? What challenges it will meet with?
Yes, we will talk a little bit about that as well.
No, I agree with you that it is important, qualitative research, but we have to also say that it should meet some challenges or change. So what is the advantage of doing, or why we want you feel that the trend is emerging towards the qualitative research?
Because qualitative research will give us much more richer data. Not like previously sociology make a lot of use in qualitative research as a field, and we in medicine we were deprived of that data. Now we can make use of that data for more planning for better medical education.
Because it, in your own context, it will
Yeah,
give you the answer to how a particular thing is happening and why it is
yes.
happening, isn't it?
It can be contextualized to that particular society, to that particular area.
Okay. Anything else you have discussed? Or anyone from the group wants to add something related to the education system and the institution? Good points. Anything
Thank
else?
you.
Okay. Few points which Zeba and I have taken out from the literature. Let's see. As you rightly said, the community orientation of medical education. We didn't use the word social accountability, but I totally agree with you. Secondly, if we consider the education system, it has that education should be evidence-based. So whatever the system you are putting, or whatever the model, your curriculum model you are putting, all these education systems should be the best evidence, and therefore the research should be directed towards that.
Yeah, I just forget. We talk also about the interprofessional education at the level of the stakeholder, and at the level of the college. We make an example that interprofessional education is a new trend which have to be applied to different colleges studying together. Because
again, my question will be why?
Yeah.
Why you want interprofessional education?
Because we would love our student to be trained in an atmosphere which is going to be simulating their real future jobs. That's why we have to teach them in a very similar way. We discussed that point as well.
Because they will be working in. Yes, someone else
like
wants to say
teamwork.
something? Someone else wants to say something? Okay. So that point is there, the last point, no, interprofessional collaboration for learning. Also, there is a lot of globalization, isn't it? People are migrating from one area to another area. Our students are also going somewhere else. They do the undergraduate in one country, they go for the post graduation to other country. And therefore, lot of emphasis is, and Zeba already said about the quality in medical education. So there has to be an accreditation, and that accreditation not only for their own country or own area, but it can be at a global level. And naturally, it has a other side that people are more paying attention to the branding and marketing, that marketing of their education. That is also happening. Secondly, because the student globalization, the students are moving from one place to another place, and there could be the ethnical diversity amongst the students, and which our education system should address. And maybe the multiple institutions may be coming together, and the student may be attending not only just one institution. There is a trend now which is coming up. The students can do two courses simultaneously, and have, while doing, suppose health professions education, they can also pursue LLB or the legal this thing. Previously, that was not possible, but it is not in all the countries, it is not the trend, but that is also emerging to some extent. Virtual university approach. Previously, there was, you mentioned about the e-learning, but as a system, what we are doing a course of virtual university. CU is a virtual university. So that approach was not there. And again, it is because it is to meet the learning needs of the people across the country. Some additional things they learn. They get the advantage from the different experts from different parts of the country. And you get a way to find out that what is going on in, as Zeba said, that diseases are spreading or diseases are now losing that boundary. And therefore, you should be aware what is going on in other part. Or sometimes you learn from the experiences of the others. And that is how that virtual university approach has started. And it is not, you can't just stop after getting your degree, but that continuing professional development should be there. And previously, it was not that it wasn't there earlier. In some country, it is more stronger. In some country, it is not. And it is like, okay, you have to have the credit points, so attend few webinars, attend few lectures, go for, and there whether you learn or you don't learn, it's not known. So the people are taking serious interest in continuing professional development. And all these things are the basic of this, why all these things have started. It is people, the spread of diseases, globalization, which is going on, and also the changing trends, which Zeba has already pointed out towards the needs of the society. And at the institutional level also, now you will see that there are educational development units which support the educational initiatives. Previously, not all the colleges had this medical education unit or health professions education unit. These units are growing up, and the people who are getting some certificate, diploma, degree in health professions education is also growing up, because people are looking. Previously, like when we entered and we became teachers, there was no training for us. Like the training is there for the teachers of the primary school, secondary school. We didn't get trained. We passed, we became doctor, physician, and then suddenly we joined the institution, and suddenly we were told to go and take a class or take this, draw the exam questions. But now people are looking at it very seriously, and then finding out that how the development, that the development unit will train the faculty, and they will decide. It is becoming a specialization. what are the different trends going on in education itself, what are the different trends going on in the theories which are emerging, why we have to do it, again from the point of view that there should be some program, that program should be, you can't have exactly the uniform thing, but there should be as far as possible, because our ultimate aim, as Zeba said, is uh, the health or our patient, and therefore the skills which we are gaining, knowledge which we are going, has to be some universal thing should be there, and then we should have those approaches inculcated in that, which may not be a job of each and every faculty, but if there is a development unit, then definitely it helps. And faculty development program, because our role says now that people, with students, the knowledge is everywhere, and the students can easily gain it if they get it. But that is, whether to differentiate between the information and knowledge is not, may be difficult for the student. So the faculty roles are also changing from the previous one. And as you, all of you may be knowing that from the teachers, we are now calling ourselves as a facilitators. So that getting to know that role is becoming, the institutions are having these faculty development programs, and the teachers are also developing scholarships. I hope you, all of you, know about what is meant by educational scholarships. Do you? Can anyone tell me what is meant by educational scholarship? Yes or no? Hello?
I think, madam, it is the publications and academic achievement. That is
So
that is no.
higher promotions.
It could, yes, please go ahead. It could be publication, it could be a training module which you have developed. It could be a new methodologies, skill learning method, technique, or it could be even your research activity. So it is ultimately something which is tangible, but it should be at a high level of expertise. It should have, it is a scholarly development. So these criteria, it should be peer reviewed, it should be in the publicly disseminated in public domain, and it should be some provide some platform so that the practices, it can have the impact on the others' practices, or it should be replicated. It can be replicated. Means if you have some training module, it should, anyone can, because it is in the public domain, second person can use it and replicate it, and it can be expanded upon. So all these scholarships, now people are saying that for teaching learning also, like people used to, previously it was just the research. You do some research activity and you do it, but all teachers can't be able to do the science research. Now, as a teacher, what I can do, how I can earn the scholarship? So it is you are teaching and learning what you are doing as an activity. Look into that, look at, develop the questions for that, and use a method in a way you are doing it, document the result, and then publish it or present it. That becomes your teaching learning, scholarship of teaching learning, and much more than that also. But in a simplistic way, people are concentrating or taking into consideration the progress of the teachers or the progress of the faculty also, based on these scholarships. So earning scholarships have become important. The institutions, if you see, that rather than the government institutions, nowadays, the privatization has increased because people want autonomy. They want some of the things to be done in their own way and get the accreditation. So that is also increasing. Social accountability, you have already told, and the program evaluation. Previously, people were not giving so much of importance to the program evaluation. Now, maybe as a part of accreditation, but program evaluation especially whether a particular program is working or not working, and what is the cost associated with it. Because once you have the quality in all these medical education, quality comes with a cost as well. So one has to see when you are having putting a particular program, whether it is a cost-effective program or not. And people are also going for the institutions are going for the international collaboration, because that has become a need. You can't have all the expertise, all the techniques, all the equipments at one place. You need the collaboration so that there is a give and take. So previously it was done in a very subtle manner, or the few students who are coming from other countries working as externs in our hospitals, or our students are going abroad. Now it has become more and more consolidified, and people are going for the collaboration, and there is a mutual exchange of the programs, mutual exchange of the faculty as well as students. So all these are the emerging trends which have been increasing. They were there in the late 90s, but now they are more and more increasing as we are approaching this first 25th year of new millennium. Okay, so let's go. Any questions, or we will go to the next one? So next one is
Yeah,
yes.
Group B, I'm going to present. Can I share the slide if you unshare your, please?
Yeah, I will do that. I will stop sharing. No problem. I'll just give me
Excuse me, ma'am. Can we talk about, although I feel it's a little bit narrow area, about outcome-based curriculum or competencies,
they will
and now
Nada, they will come now to this.
Yeah.
I hope that let's hear from the this group B. Group B is going to talk about start sharing. Group B is going to talk
But it
about
is
the
written
curriculum.
disabled, host disabled participant sharing screen. So if you allow me, then I can
1
share.
second. Dr. Mubashir, please make him co-host. Dr. Mubashir?
If no, then I can just speak.
1 second. If I can make you co-host.
It will be,
What's
Dr. Arshad Ikram is co-host.
okay, right. Now is, okay. Okay, everybody can see?
Yes.
Right. So our task is Group B task is emerging trends in curriculum model and content. So what we think that now is as compared to the previously traditional fashion, the curriculum, now we are more toward the outcome based, which is more student center, and it is interactive, and we are emphasizing on the outcome. If outcome is more achievable in a small group like a TBL or a micro learning, we interprofessional, our content are more interprofessional, involving the other profession like nursing profession, physiotherapy. Is more community oriented, means involving the, for example, like in countries the diseases are not common, but we are still neighboring countries where diseases are common. We are involving those into integrated, mean involving the basic knowledge, basic sciences in the clinical sciences, integrated more towards the personalized learning, digital literacy, more technology enhanced in this one modality are coming. So this is the content which we are emphasizing in the new to face the challenges. So that's why in these are the emerging trend in the new curriculum. So my other colleagues are all very active, Dr. Noman, Dr. Azim, so they can also participate. So Dr. Noman, yes.
Yeah, thank you. Yes. And which challenges it will meet? Means suppose it is integrated, then why we want it as an integrated?
Integrated also, like for example, I'm orthopedic surgeon. So if I integrate this with the model of the anatomy, pathology, or this, so all integrated means then the outcome is a better in the learning. So that's why we want to be integrated curriculum. Micro learning, one only small model of outcome. Interprofessional, involving the other professionals. So that's why we discuss in our group, and we come out with this that this should be the content in
But
the.
remember that there are theories of learning, isn't it? And how
right.
we learn and how people learn. And we had those sessions earlier. So all these changes which have happened in the curriculum are have a basis of those theories.
Sure.
That there is a when we are working, you have to retain your knowledge. You have to do deep thinking. So if it is done in collaboration, or no, so peers working together, or whenever it is an active learning, then only you will be able to retain it, isn't it?
Correct.
So
Correct.
we are trying from the traditional one, which was more and more passive. We are moving
Correct.
now towards more and more
More
active
active.
type of learning.
And student center
that's
rather
why
than the
you are
teacher center.
giving it as a micro learning or
Hmm.
small group learning.
Right.
Good.
So yes. So this is our
This is group
B. Group
B,
B.
no?
Yes.
Let me share mine now. Again, let's something more. You can see, no, this, okay. So what we have found, Zeba and myself, again, this globalization with local contextualization. So your program, even if it is outcome based or it is competency based, whichever curriculum model you will select, that has to be contextualized. So at one end, you are looking at what is happening in the world. But on the other end, you will be selecting or concentrating on the health needs of your own society. Community orientation, we have already covered earlier. But modularization of the program, you will see most of the program now going on as a form of modules. So so that content is, and the major thing is based on the skills rather than the knowledge, because knowledge it's expanding so much that whatever we teach them, they may not be, you must be knowing that doubling of knowledge. No? Now the stage has come, in 3 months, there may be something else only. So that may not be possible and they can retire. But the basis of that, or the skills which are required for that, that should be more emphasized. And that through the different modules, people can learn the skills and those outcomes for the individual learning outcomes can be decided for the individual modules. Together, that can form the learning outcomes for the entire program. People are also trying to give the personalized, tailored programs also based on the needs. So one hand, we are increasing the efficiency of any program so that it can be across the global area. Anyone can join with the e-learning, and we are going. On the other hand, it can be personalized, it can be tailored, maybe through giving them the more space to learn according to the way they want to learn. And the focus is ultimately whether the outcome is achieved or not. People also are going for the flexible curricula and the agile curricula. What is meant by agile and flexible curricula? Depending on the needs. You must have realized that after COVID, many of the universities have started adding that module on the COVID or the pandemic, how to deal with another pandemic if it comes. So all this leads to the change in the curriculum which occurs earlier. So it is not very rigid or stiff curriculum. That one has to, now we are using the terminology also. We should adapt. We should adapt to the program, and one should be adaptive masters as a faculty also. So the changes can occur anytime, and we have to do. Integration, you have already stressed upon. There is a decreasing stress on the factual knowledge, which we said. And this competency-based curriculum, if you are looking at the outcomes are looked at a particular competency which is achieved or not. And when we are doing it, the one requires to find out what are the professional activities and these EPAs, and which the student should master and then assess those EPAs. So it is not just the one professional activity may consist of multiple competencies, but that is what a doctor is going to do in the real life. So the emerging trend is to have this competency-based education with the development of EPS, so and train them in. The emphasis as well as on the clinical skills, and earlier group also mentioned about broadening of the clinical training, that bedtime teaching need not be in the hospital. Bedtime teaching can go outside the hospital. You can go to the community. Bedside teaching can be there from the e-learning platform. And one has to use we also discuss about the simulations, no? So supplementary use of the skill labs, rather than previously only the real patients were have been used to learn. But now people say that the patient safety has become a very important consideration. So people say that the educators say that one should use the skill laboratory facilities and emphasis on the communication skills. So in the content, the communication is a very, very important one. Also the team working. So when we are every time the interprofessional education may not be possible, it is still in the infancy in many, but at least the concept of team working should be given, along with these things, the professionalism, ethics, leadership quality, all should be now become a part of our curriculum. Previously, it's not that professionalism, ethics, and leadership was not taught or it was not there, but it has now made as an explicit thing in the curriculum. In different countries, in different ways, like I can talk about India, we have a ATCOM module, which is a longitudinal module, which from the first year, it goes till the last final year. So this module has different cases which are built in the professionalism, ethics, and it is the main way is the discussion with the students, because there is nothing, you can't always talk about right and wrong. It is again related to the context, but helping the students to make the decisions later on, you are making them aware the different aspects. So it has become into the curriculum itself. You can use it along with any competency at the bedside teaching. At different places you can, different settings you can teach it. But it has to be taught. You can act as a role model, but don't only depend on the role model. A cautious effort has to be made to teach these aspects, to make the students. Already Zeba told you what are the skills which are required by a 21st century physician. So through this, the content, you can do it. Okay, let's go to the next one.
Can I ask one comment, please?
Yeah, sure.
On this one, like you mentioned that professionalism, communication, and the leadership. So that's why our university wants to include the interprofessional means the medical students combined with the nursing student. That will increase the develop, enhance the leadership, professionalism, and communication skills. So that's why this one of the model. That's why interprofessional is very important to get all these three things. Thank you.
Yes, very good, very nice. Group C.
Madam Namaste, greetings to all. Myself, Dr.
Yeah.
Vinod Babu, representing Group C.
Yeah, you also want to share, Vinod?
No, sir. No, madam. I just discussed, madam.
Yeah.
Our topic is on teaching learning methods, emerging trends. I first of all thank my teammates for giving me an opportunity to present before this elite team. And we all personally felt that Corona has taught a lot to us, where the complete teaching learning methodology has changed the whole scenario, what we are following before 2019 and after 2019. It has been like before Corona and after Corona, where newer technologies, newer way of assessment, newer way of teaching, newer way of learning, all these were actually, we were just learning in books where these type of learnings are already there, like flipped classrooms, all those were there. But all those were implemented only in this 2 years time, 2019 to 21. So these 2 years taught the whole world what kind of teaching methodology can be done in emergency conditions, and also an easy way of doing assessments, and easy way of assessing students, and easy way of chatting with students, all those were done in these 2 years period. And with respect to teaching learning methodology, what's the emerging trend happening? There were many softwares developed during this 2 years time, where Zoom is one such platform through which now also we are having interaction. Different kinds of courses, classes are being conducted. Teaching learning methods are being done. All these are because of the newer novel platforms developed, which is being helpful helps to connect people across the world globally. Where across the globally, in this group itself, we have more than 30 members. We are all from one place, from all other places, from global, any part of the world. We are having a touch contact here at this point of time. All these are made possible only because of this internet connectivity. And this website and this are going to bring many advantages than the disadvantages. Even though there are disadvantages to be particularly told about, but more advantages are there than disadvantages. And in respect to assessment part also, we have this many platforms developed like Kahoot, Quizlet. All these are helpful to assess people, and even NEET PG, Next PG, all those PG and UG questions, all those are being done online. All these assessment kinds being done online. All these are helpful for the students also, and also for the faculty, which has made it easier for the faculty to do assessment also. Like they do morning, they come, evening they finish the test and go, and night itself they can release the results. That's the best way of showing how the assessment is.
So formative assessment.
Yes, madam. And with respect to courses, whatever being conducted, online courses, diploma courses, certificate courses, all these are being done online. Even our diploma course on health education, all these are being included. Students can learn anywhere, anytime, any place, and they have the liberty to download materials. They have the liberty to store the content. All those can be done. And along with that, I just want to tell that virtual platforms which are being play a major role, even the 3D learning methods for anatomy, all those are being developed. All these are additional techniques which are being developed these days. 3D anatomy techniques where 3D specimens are being formed. All these are being plastination techniques. All these are useful for the students. Along with the flipped classrooms, jigsaw method of learning, role play in mainly in EdCom and early clinical exposure. All these are additional points which can be added, where the novel technologies are being developed. And role play definitely plays a major role, because definitely the student not only needs to be in online, he needs to come offline, he needs to do the role play in front of the students, a group of students performing in front of their friends itself, making it joyful for them also. At the same time, learning is also being done. And the NMC also
skill
adds
learning, attitude learning.
Yes, that's what EdCom, madam. I just mentioned about EdCom and the early clinical exposure. All these role play will help us very well. And NMC also adds some burden to the faculty, where the novel new amendments tell that we have to take video of assessments, take video of the theory exams being happening. All these are, of course, a burden, but they want to take control over all the institutes where they are able to identify where the correct assessment is being planned, followed throughout the country. A particular standard of assessment is being followed throughout. That's what the NMC wants to, but that is also in one way it's correct. But of course, there's a big cloud which is being involved here, where how much amount of data being involved in assessing or in recording those videos, all those to be taken into consideration. And all this collaborative learning and interactive experience among the students for teaching learning will make their studies better. And recent trends also adds with evidence-based learning, along with different platforms like Google platform, PubMed, that is also helpful for us in research experience also. Students getting research activities where the ICMR gives students short-term students project. All.
Hello. Yes, very rightly pointed out.
Madam, audible, madam?
Yeah, you are audible.
Evidence-based learning, where the new platforms, not new, it's already available. Google Scholar, PubMed like platforms being used for research experience for the students. ICMR, SCS projects are being given to students. All those can be done using this website platforms. Of course, that will be new for the students, even though we are all used to it. And OSCE and OSCE kind of assessments are of recent trends, where many universities have implemented OSCE and OSCE kind of university practical examinations in their own setup. And formative assessments, of course, have been changed to some trends, where faculty have been started to discuss about what kind of evaluation pattern to be followed and what are the guidelines for assessing a particular answer sheet. And they sit among themselves. The faculty first know or add points where these points, if there, we can give marks. So they give some checklists so that it makes the assessment perfect and 100% non-biased. So these can be followed, and also to give a proper feedback to the students. There are some institutes follow writing feedback in the answer sheet itself. Some give their mentors and mentees, they go and meet the respective mentors, and the mentees get their corrections, whatever is being the respective mentors. These also to be added. Last 2 points where simulation in medical education is a big place which has a bigger role to play in these upcoming institutions, where simulation lab itself is separately set up along with skills lab, and these simulated training. We also, along with the additional technology, they are doing some surgery skill-based learning, all those suturing techniques, all those being trained along, all these are being done in the simulation lab also. So this simulation lab is being helpful in many cases where the patients don't feel any pain. For example, suturing techniques and all can be done in simulation type, and then they can go to the patient so that the patient doesn't have any pain while the new doctor does it. Last but not the least, we have the artificial intelligence, which is a boom here and a game changer in all the places wherever we are coming into. Wherever the routine pattern is followed, the whole scenario can be changed in another many years. More down the lane, after 10-15 years, and more of teacher-centric learning will go to the student-centric learning, where there won't be any teacher, but the class will happen, the students will come, learn and go. That may also happen in future. Thank you, madam. Thank you for the opportunity. I thank my teammates again.
Yeah.
I think ma'am,
Thank
he
you,
has covered
Dr.
many of the points. Nirmala, ma'am, I think he has covered many of the points.
Yeah,
Please
yeah,
continue,
sure. He has
ma'am.
covered many of the points. And though Dr. Vinod, you have mainly concentrated on what India, what is going on in India. I think some of the countries, the same thing is happening. And some developed countries may be already having it, and they are moving ahead with the additional technology. So the first thing is that active versus passive learning, that all of these to have them actively engaged into the learning experiences, small group learning, feedback. And remember, all of you, mentoring, feedback, and reflection, these are the backbones of any learning activity. So we are now more and more focused on that, how to give feedback and how to receive feedback, both the ways, reflections, and how to write the reflection and how to assess the reflection. And you have already said about the mentor-mentee program. So what Zeba was saying about that application of the knowledge, that has been covered, and the autonomy to the learner is also given. Don't forget the self-directed learning. That is also very much emphasized in this. I already told you about the adaptive learning and the technology supported near patient journey learning, mobile-based learning. So whatever the new technology has come, and I think people will talk later on, but you have covered almost all of them in your talk. Well, and at our place, it is OSCE, and OSCE is given more important. At other end, the people are also trying to have the workplace-based assessments with even for the undergraduate students. And those papers are also published, that workplace-based assessment, which we are restricting it for our residents, but they can be tried on the undergraduate. And naturally, when you are going for the competency base, you have to have the criteria and reference assessment, simulation based or technology, able you have said, and e-portfolio and assessment of portfolio. So if you are going to it is always a challenge and the support. You have to challenge your students so that they can do better. But if the support is low and even the challenge is low, there is a stasis. If the support is low and the challenge is high, the people will not, our students will not like to do anything. So there is a retreat. They will say it is out of their interest area, or they can't manage with it. If the support is high and the challenge is low, it can be used for the confirmation whether the person is. But where the growth will occur, if the support from the faculty in form of feedback, mentoring is high, and the challenge is also high. So this one has to remember. Let's go to the last one that is related to the students, patients, disease, and technology. The last group
Yeah.
B.
Excuse me, ma'am. Can we add intrustable professional activities as some sort of work-based assessment nowadays. It's actually a trend as well in trustable professional activities.
Can you repeat that, Madam?
And
What
EPA,
you
she's
said?
talking about EPA. EPA we had discussed in the previous group.
Yeah, we have
Yeah.
already discussed it. Okay. So who from Group D will be
Good
talking?
evening, Prof. My name is Dr. Thiru from Group D.
Okay. Yeah.
Prof, most of our things are already covered by other groups. Just I think it seems to be we are summarizing the things. Regarding our side, regarding the students, world is open for the students to join national and international student associations for collaboration of teaching, research, and all other activities. And second one is the exchange programs for the students. Worldwide, they can go for any exchange programs like dual degrees or partner universities. Means half of the medicine they will study in one place, another half will be studied in partner medical schools. Second one is entire learning, teaching and learning now moved to technology enhanced things. So traditional teaching is going very down, totally depending on the technology. And second one is open book exams and web-based exams and virtual reality models. And finally, peer group support is there for the students. Second one for the patients, they have the virtual healthcare assistance and personalized medications. Advantage of AI-assisted healthcare. Detailed information about diseases is available in online and mainly support groups regarding the diseases. For example, dementia support group, Alzheimer's support groups, spinal cord injury, all these support group, disease support groups are there. And next one is the borderless doctors. Regarding the disease, now most of the diseases are diagnosed by technology-based investigations.
Yes.
And regarding the diseases, complete information is available in different sources in online platforms. And next one is the technology, and most of the things are all the three groups covered. But we want to add some robotic surgeries are developed, and navigation surgeries and technology-based means navigation. That means, for example, if some surgeries nowadays they are totally depending upon the navigation surgeries.
Yeah.
This is
So-
from the Group D.
Yeah. So this is mainly related to the healthcare services.
Yeah.
But we have to take account of that, and we have to bring that into our teaching especially for the postgraduate, isn't it?
Yes,
This navigation surgery or robotic surgery.
yes, Prof.
And even for the patients also, support group and everything becomes a part of the healthcare. But
Yes.
the patient education programs that has been coming up quite a lot. No, you are looking at a patient in a different way.
Yeah.
So for the students also, that main thing is that previously we used to think the student as a consumer of knowledge, that I'm telling you to do everything and you will have to reproduce it. And the student used to say, okay, I will listen, I will copy the notes, I will memorize, I will reproduce. So he is totally that consumer of the knowledge which has been showered upon him by the teacher. As against this, now the students are becoming the partner in learning, and that is a big change which is coming up. And all those active learning techniques and what you said in the teaching learning, all revolve around this concept of students becoming a partner of learning. So that we tell the student that I need to know what you know, I need to understand whether you have learned, and I will help you to develop your own understanding. So the student has to say that, okay, I will explain, I will show you what I have learned, I will enter into. So that even with any of our student-teacher relationship, it's changing a lot. And there is a responsibility is not only of the teachers as it used to be, but the students are also becoming a responsible learner. So that principles of respect, responsibility, reciprocity, all these things will be there. Then related to the patient, the main focus, and even if you go for the WHO, main focus is on patient safety. So that is the main thing for the simulation labs and all those things. Why we want it? We want the patient safety is our first goal. So there are programs which are developed, and in our also education, those patient safety elements should feature, and that will may come through the ethics, giving the how to deliver that informed consent, or how to informed consent before any surgical treatment, medical treatment. All those things will be there, and patient education also. Like, and we are involving them directly. The like I am a pharmacologist, so I can tell you that pharmacovigilance program. It is previously, it was only the doctors have to report if there are adverse drug reaction, but now the patients can report. In our ethics committee also composition, we have a lay person over there, and that person plays a role. So along with the health literacy, we are involving our patients. So like students are our partners in learning, the patients are also our partners. And patient
Ma'am, one point, can I
Yes, yes.
one point here, that patient preferences, actually what we mean is that it's a part of ethics. So we are also teaching our students ethics as a separate subject now, because we have seen deterioration of generations. Like, they don't know how to talk to the patient. That is one thing. They don't take proper consent. They don't pay attention to what the patient prefers. If a patient does not prefer to be put on ventilator, we cannot force them. If they don't want to be resuscitated because of any reason, we can't force them. So we have to take patients' preferences in mind, and we have to teach that to our students also. That medical profession is not just about learning and practicing that learning knowledge part, but we have to take care of this affective domain, which has become lesser and lesser over period of time. And also the self-care group, this they told about the self-help groups for dementia and other diseases like Alzheimer's, but also for people who are aging, like with better healthcare. We have a lot of people who are on the in the 70s, 80s, or maybe older. So we also need, they have a different set of problems. So we can have especially the people going into special field like geriatrics, where they can provide support for these group of individuals. And they can also form an online platform where they can discuss their issues and problems. And we can help our students, motivate our students to work in those fields which have lesser number of people involved. Like one of them is obviously geriatrics. And for the non-communicable diseases, like we all know, diabetes, hypertension, and all, they have been increased because they're lifestyle diseases. And because of changing lifestyles, because we are, if we see the Western countries, the South Asian countries lag like 10 or 15 or 20 years behind them. So what diseases were prevalent there 20 years back, now they have come here with the advent of this fast food and this lifestyle, sedentary lifestyle. So these are now emerging here. Previously, infectious diseases were more common, but nowadays cancers and non-communicable diseases are more common here. So we have to teach our students that before writing any medications or drugs, we have to advise our patients for lifestyle modification. That is most important. Dietary changes, exercise, lifestyle modification. So every time we teach our students, we have to emphasize that lesser the drugs, lesser the medicine, if it is required at all, more we have to take into account the lifestyle modifications. And that is what I wanted to say, ma'am. You may continue.
Yes, perfect. Now that was in my mind. And when we are talking about the self-care, it is self-medication also. Means
Yes.
like previously we used to tell patient come as early as possible. Suppose a patient is having gout, then and when there is a gouty flare, you know that as earlier we start the treatment, better it is. But now after that you diagnose the patient to have gout, you can say give the medication to the patient and tell the patient to self-medicate, and that trend is also changing now. So because we are relying on the patients and supportive learning environment, people are becoming more and more conscious about what should be the learning environment, and there are studies which are emerging of how the educational environment is there. And you talked about the qualitative research. So one aspect of this qualitative research is to find out what is the hidden curriculum and what is going on in students' mind and what they are perceiving it, and then to take the corrective steps. You talked about the AI or also ChatGPT. We can use it, and definitely we should not shun away from that. So these points I've taken from someone else's presentation. Some of them. Starting point, you can use it as starting point in classroom, or invite ideas for classroom activities, develop case scenarios, so that you can provide experiential learning, and for personalized lesson plan, or for the leveraging the social media platforms, as all of you said, to engage the learner. And educational research also, there are changes which you have already said. Qualitative research should be there, but more now as a quantitative and qualitative, that mixed method research, because both the things, ultimately we are interested in solving our research question. So whichever method we can use, each method has got its plus and minuses. So use the mixed method research to find out the answer. And educational scholarship, we already discussed. We talked about the teaching scholarship of teaching learning, the scholarship of application, integration, and then the dissemination of all the knowledge, collaboration, faculty development. So all this is that educational research. There are developments which are going on. There are techniques which have been tried, like previously we used for the Delphi technique used to be done. Now eDelphi has come up, and it is getting very much popularized. So all those things one should take into account. Now, when we are talking about this, I want you, this is my last 1 or 2 slides, to predict the changes. So when we are talking about the research, can anyone predict the changes or identify and analyze? So there is a paper which is actually from Iran, but it's a good paper, Global Perspectives on Trends in Health Higher Education. And they have come out with many more trends than what we discussed with you. But this type of technique can be used to identify. They have used this model, which is called as STIF model. Previously in the research, there are some variations in this model also. STIF model was used, STIF model is there. There is another one with the legal and ethical views. So ultimate aim is to find out what are the trends in the HPA that health professions education will occur at different levels. Because all these trends are ultimately, you know, that it is because of the changes which are occurring in the different areas, or they are like the social areas, the technological areas. That is what we were discussing, and that is what Zeba told you earlier. So using this economic, ecological, political value, they have come with that acronym as STIF model. So to examine what is the influence of these external drivers on the education. So it is actually a qualitative research where you can do the mapping against the relevant categories and explore the systemic relationship between these. So this has been used but you have to define what you are going to see, because whatever is defined over here in this particular slide, the same model was used by someone to have the water sources in Russia. So they have interpreted in that terms. So when you are using this model, you have to see what you mean by technology, what is meant by economic, environmental. And what earlier those people have done, this Abbasi and others, which they have used, they have did the literature review, and whatever the new techniques have been coming, they selected them. They had their inclusion and exclusion criteria, and they searched that quantitatively as well as by the qualitative analysis. They use the thematic framework. So it was mainly the qualitative research, and then they collected and they have summarized and they have produced a table showing that what are the emerging changes are there. And we will give you this paper. It is interesting to know. And that is what suppose if, and as you are aware from this also, If we can predict the future trends, then we can get ourselves prepared for that, and we can slowly start doing it rather than something comes up like in COVID, and then suddenly we are making changes. Everyone knows that how difficult it is. So it is always better to predict some change and start preparing ourselves towards it. So then we can have some time to concentrate and do it in a very proper manner. That's what we were trying to cover in this particular webinar. And I will request Dr. Zaidi, if he's still there, sir, if you want to add something. I don't know whether sir is still there. He was in the breakout room.
Yeah, I just
Sir
say a
is
few
there.
words. Thoroughly enjoyed this entire session. Let me start by saying what you said earlier on, that when you enter the medical school and you finish and you were asked one day to go and teach, you had no idea because you were not taught how to teach and how to train. About 40 years ago, when I started the first program of medical education in Pakistan, in Dow Medical College, one of the senior physicians came to me and she said, she was apparently in charge of education, that you're saying that we have to go back to school to learn the teaching modules and practices. Are we not teachers? So I told her that you're a fantastic clinician, a pediatrician, but not a teacher. To teach, to teach, you have to learn the art of teaching. Just like you said, a schoolgirl who goes to teach at a school, at a teaching school, after graduation, whatever, she has to do a course called BT, CT, whatever, learn the theories of teaching, the models of teaching, practical application, assessment, etc. So that was one thing that I thoroughly enjoyed. All chapters that you've covered, all the subjects are superb. The crux of the matter that I see has come up, that we have to remain on top of the progress as it is moving fast. And like your last description or definition or detailing of the futuristic medicine, there is a book that is coming out. I think it's in the press at the moment, Futuristic Medicine. Somebody sent me a reference. Exactly that. We cannot predict what's happening. I mean, COVID came out of the blue. And the silver lining of that horrible black cloud was the online learning. So even if the technology is overtaking us and we have to remain on top of technology, futuristic medicine is going to be totally different. And what I fear is that, and this is not a fear out of fear, but fear for the sake of saying that transhumanism is developing. You've heard about Elon Musk use this computer thing, a brain chip, etc. I know a person, personal friend of mine, Naveed, in Canada, in Calgary. He's been doing this work on using computer chip in the monkey brain and transmitting all the information from the monkey's brain into the computer to predict the actions, etc. The same we can. So what I feel is that in order to keep updated in education, this course or the online programs, they are insufficient. You have to read a lot. I mean, 100 pages a day is what is a prescription the doctor tells us. To keep updated, read everything. Holistic medicine means not just confining yourself to medicine, but also history, humanities, ethics. I'll tell you two very basic examples. Two of my grandsons, they study here. One is at Imperial College in second year. The other one is at St. George's in London. And when you talk about contextual curriculum and the education and technology, would you believe it, at the Imperial in second year, he was allowed to go and sit on a Da Vinci, what's it called, Da Vinci simulator robot and practice cholecystectomy in second year. And the other one at St. George's is conducting courses, teaching his own peers and students. So everything is changing. What is important for our developing countries is that we should not take any particular example from one country to the other, but also develop our own technology. God has given us all the resources. We should advance our technologies and have collaborative programs of different countries, like Iran is very advanced, India is very advanced, Pakistan is catching up, African countries. And this CV platform, along with ERAS, is a wonderful platform to exchange ideas, concepts, discuss, and learn from each other. All of us are students in our heart. At the heart of our heart, we are students. We are not teachers. We are perpetual, lifelong student. And I'm the oldest student of all. Thank you for your wonderful session.
Thank you, sir.
Thank you,
Thank
sir.
you,
Thank
sir.
you for. Any questions, or should we call it a day? So your
Yes,
name
madam.